Hello, everybody. Hello. Happy Self-Care Saturday. Give everybody a couple minutes to get in here and we will get started. Hope everybody is doing well today. Come on in. Hello. Hello, hello. Hi, Tarek. Yes, we had to pivot today, but we are glad you are here. Come on in and happy anniversary to the Rainies. Hello, hello. If you are joining me, make sure you drop your name in the chat so I can see who is here. If you are watching this as a replay, please put hashtag replay so that I know that you saw us today, that you were here. We have a couple more minutes and we're going to jump right in and we're going to talk about the enemy amongst us. I know everybody wants to know what in the world we're talking about. What does that even mean? So, hi, you guys. There's five of you in here. So if you can, I'm going to actually see if I can bring this up a couple of ways so I can see you. Hello, hello. Come on in. All righty. So thank you guys for being here. I'm Dr. Kelly. I am your board certified internal medicine physician. Uh, Hi, Tanya. Dr. Rainey. I was about to make you a doctor. I am Dr. Kelly, your board certified internal medicine physician, speaker, and patient care advocate. I help patients improve their healthcare outcomes by educating them on making better decisions. I am a hospitalist, which means that I practice hospital based medicine. And today we are talking about the enemy amongst us. Alrighty, so I know everybody wants to know what's the enemy amongst us. Alrighty, so this is a topic that hopefully will be of interest to quite a few people. We're going to talk about high blood pressure today, just for a little bit. And it is the enemy amongst us because 40% actually of most minority groups suffer from high blood pressure. African Americans, Hispanics, Native Americans, 40%. And so for African Americans, there is some data to suggest that is predicated on our genetic predisposition to salt sensitivity, right? So our bodies respond to salt by elevating our blood pressure. And so 40%, that's almost half of us, are going to suffer at some point from high blood pressure. So I am calling it the enemy amongst us because one, if you don't have high blood pressure, then someone you know does. So let's talk a little bit about high blood pressure. So what we consider to be normal blood pressure, back in the day, it used to be 120 over 80, 120 over 80, right? And so today, our numbers are a little bit different, and it also depends on other conditions that you may have. So if your blood pressure is 120 over 80, more than likely um, that's going to be perfect. And it also depends on your age. So 120 over 80 tends to tend to be a little bit lower for our older population. So if you're 80, 120 over 80 in some circumstances could be low. If you're 25 or 40, that's right on the money. Our diabetic patients, we like them to be less than 130 over 80. That's the top number is called the systolic blood pressure. The bottom number is called the diastolic blood pressure. And so 130 over 80 is pretty good for a good shooting point for our diabetic family. Um, Technically, by the guidelines, which kind of change every couple of years, having a blood pressure of 140 over 90 or less is still considered to be a normal blood pressure. Okay, so now we kind of have a little bit of a definition of what's normal and what's considered to be abnormal. Let's talk about the effects of having high blood pressure. So, um, when you think about pressure, and I always try to teach my patients to think about processes within the body um, in a more common sense way. Sometimes, if you can take it out of the context of a medical problem or a medical term and put it into context of something that people understand, then it kind of connects a little bit better. So, when you think about your blood pressure and that whole how the body works, think more of like plumbing and pipes, right? And so your heart is about the size of your fist, right? Give or take. And so it's not very big considering the work it has to do. So the higher that your blood pressure is, the bigger that muscle, your heart, has to get. So for those of you who may have family members or who have heard of congestive heart failure, the vast majority of times it's going to be related to something, be related to your blood pressure. There's some other conditions that can lead to it as well, and failure of other organs that can also lead to heart failure. And we'll get into that another time. Hi, Kenneth. Thanks for joining me. Um, but basically, your heart sits kind of in the middle of a circuit, the middle of the pipes, right? And so, in order for them to push things forward, so by forward we mean healthy, oxygen-rich blood from the heart through the body, right? So it leaves the heart and goes out from the middle and goes out to feed your arms, your legs, your brain, everything, right? Let's consider those pipes. So if the pressure in those pipes goes up, it gets high, then your heart has to do more work because it has to push against the resistance, against what's out in the pipes, right? So those pipes are your arteries. So hopefully that kind of makes a little bit of sense. And so just like any other muscle, if you want to lift a 50-pound weight, your muscles you have to recruit more muscles to do it, and they have to get bigger, right? So think about somebody who's just starting working out and then somebody who's been working out for years and they're buff, right? Those same muscles, they just got bigger, right? They got trained to be bigger. Same premise. So with your heart, that's not a good thing because it can only stretch and get so big until it will start to fail, right? And so high blood pressure is probably one of the number one reasons that your organs go into failure. So your heart can do that. Elevated blood pressure also affects your kidneys. And then you can actually have high blood pressure affect your kidneys and then in effect again cause your heart to fail further as well as your liver. And that's because the whole body, every organ works in a circuit. They work together to do a job. And so what happens at the kidneys can also cause a problem over at your liver. Can cause a problem with your lungs because when fluid, now here we are back to our pipe analogy. If you flush a toilet and it gets clogged and things can't move forward, what happens? Everything comes back up. So it's synonymous with your toilet overflowing, right? Same principle. So when the heart gets to a point where it can no longer push things forward, then things start to move backwards. So then you get fluid into your lungs, you get fluid backing up towards your liver because that's the organ or one of the organs that is actually on the backside. It's the last stop before it comes back to the heart. So everything kind of moves like this. And so at any point where there's a backup, it can cause a problem behind it. Same thing with pipes, right? If you have a problem in the main sewer for your city or your street, it can cause a problem in your home, right? Same premise. So that is why I consider blood pressure, and I would say diabetes is as well. But we'll talk about diabetes. That's a beast in and of itself. So let's talk about, like I said, today we're going to focus on high blood pressure and why it is the enemy amongst us because it causes so many issues. So we've already talked about how it can affect the pipes, right, which is the arteries, and it can affect them everywhere. So really high blood pressure can also cause you to have a stroke. Another organ is affected. That's the brain. Arteries also, that's healthy, oxygenated blood that leaves the heart and goes to feed the brain. But if there's any slowdown, if there's any thing that's blocking that process in the brain, when blood slows down and it doesn't move smoothly, it starts to get sticky and it puts you at risk to have a blood clot essentially, or what we call an infarction in the brain, also known as a stroke. Okay, so for those of you just joining us, thank you for joining me. We are talking about the enemy amongst us, which is high blood pressure. So far, we have talked about how what is considered normal and how that is going to depend based on the patient and based on what other conditions they have. But generally speaking, for a healthy person, blood pressure 120 over 80, 140 over 90, somewhere in there is considered normal. Our dialysis patients, patients who have kidney failure and go and get dialysis, their blood pressure tends to run low. Sometimes as low as 90s over 60s or 100 over 60. And that's normal for dialysis patients. For our diabetic patients, their goals are 130, which is the systolic, that top number, 130 over 90 or less. So those are our goals. And we've been talking about basically how high blood pressure, just that one thing, can cause multiple problems within the body. So we've talked about how it can affect the heart's ability to pump and function, which is called heart failure. And like I said, heart failure is a topic in and of itself, and we could spend a whole session on that, and maybe we will if there's interest in that. But basically, your heart is a pump. It's a muscle about as big as your fist, and it is designed to pump against a certain pressure in the body to function, right? The other thing that can affect the heart's ability to function is okay, so you've got high blood pressure, but you're also overweight. Your body is only, your heart is only designed to pull a certain amount of weight. So think of like a car and an engine, right? You got to, you go up to what, a V12 engine. That's a really powerful engine. But if you can't expect to pull the same type of load with a V4 that you can do with a V8 or V12, right? And same thing. So your heart is trying to increase its amount of power, but to do that, it has to get bigger. But in doing that over time, because your pressure or your weight or both are so elevated, you cause the heart to get weak because it simply cannot function at that level. And so that causes a lot of problems. We've also talked about how you can have multiple organs go into failure because your blood pressure is so elevated. So what's happening at your kidneys can affect what's happening in your liver. What's happening in your liver can affect what's happening in your kidneys. So the body is a circuit. It basically, there's no interruptions. So anything that happens on one side of the system can affect the other side of the system. Very similar to piping. Okay, so hopefully that makes some sense for you. So several things can, be affected. We've talked about the kidneys. We've talked about strokes, right? Heart attacks. Heart attacks are basically when part of the heart muscle dies off. So congestive heart failure. And hi, Sora Nicole. Welcome. Thank you for joining me. Basically, that's where part of your heart muscle actually dies off. And again, it's a piping problem, right? So there are several pipes, systems that feed the heart. It's a pretty meaty organ, right? And um, it has a system set up to feed it, but it also has a backup system, so to speak. So how bad your heart attack is, right? You've heard people say, I had a mild heart attack, right? How bad the heart attack is depends on what part of the pipes are affected. Okay. And again, those pipes are the what? Hey, Brittany, thanks for joining me. Those pipes are your arteries, right? So again, very similar to how you see your pipes and your sewage at home, right? So it can cause you to have a heart attack because again, when blood doesn't move, it gets sticky, can cause blockages, can cause narrowing of those vessels. So think about it. Same thing. Let's take it outside of the body. If you have your sewer is full of leaves, and so water can't drain properly, then what does it do? It backs up, right? Well, that's not a good thing in the heart because that's a huge muscle. Remember how much work we're asking that organ to do. What its job is to pump things forward. So when that doesn't happen, you can get blood clots or get areas of narrowing in those pipes, and that can cause issues and cause you to have a heart attack. That part of the heart that's being fed by those pipes, that is not happening, right? So when we say, oh, we've had a massive heart attack, that's because it's in either one of three. You can have multiple pipes that are affected, right? And that's usually what a massive heart attack refers to. Okay, so hopefully that makes a little bit of sense. Um, um, to you so that it kind of, isn't such a foreign concept. So the enemy amongst us, why did I call it that? Because one, it can be silent for a long time, especially if you're not going to the doctor on a regular basis. So if you're not going to see a physician or nurse practitioner or some kind of healthcare professional that's actually checking your blood pressure on a regular basis, whether that's every year or every 6 months or what have you, based on what your medical conditions are, then you don't know you have high blood pressure because you don't always feel different or know something's happening. So it's called the silent killer. And like I said, 40% of minorities. So you can look at any minority group, African Americans, Hispanics, Native Americans, Pacific Islanders, 40% of us are going to have high blood pressure. For African Americans, there's some genetic connection, meaning that it's just the way we're wired. We are salt sensitive. And so in the body, water follows salt. Okay, remember that water follows salt. So you eat a big salt load. Some folks get bloated, right? Because water tends to go with it. Same principle, same principle. Okay, so silent, because if you're not checking your blood pressure, you don't know that it's high. You don't know what it's doing. Some people get headaches when their blood pressure is high, and some people feel nothing at all. Some people's vision gets blurry depending on how high their blood pressure is. If you start getting those types of symptoms, then your blood pressure is very high, like in the 200s. I think the highest blood pressure I've ever seen is probably like 260 over 150 or something like that. I mean, I've seen some pretty crazy blood pressures in the hospital, and that's what we consider to be an emergency, particularly if, like I said, there are organs that are starting to fail. And usually the organ that gets upset first is your kidneys, right? And so that's another reason why going to the doctor is really important, is because there are little indicators that things may be going on that we can pick up from your lab work, that we can pick up from your blood pressure. So remember, pretty much your blood pressure can affect any organ in the body because it affects and has its most damage on the pipes, which is your arteries, right? And we know that those arteries are what is bringing or carrying oxygen and blood or oxygenated blood to all of our organs, to all of our tissues. So, what happens if the pipes are clogged? How are you going to heal that wound that's on your foot, right? Well, the answer is you won't. Um, God designed our bodies in such a way that they are that is self-preserving. So it knows to take care of the core first. So the core is basically anything in your chest, right? So it's going to take care of the core organs and try to keep your core as happy as it can. So that's your heart, your lungs, your liver, your kidneys. It's going to do its best. So if it has to sacrifice something, it'll sacrifice your foot, it'll sacrifice your fingers, your legs, because those are not your vital organs. Now we can argue about that later. I think my arms, legs, hands, and fingers are pretty vital, but in the big scheme of things, when your body has choices to make to preserve itself, to keep itself, um, that it's going to make those types of choices. And you may beg to differ with the choices that have been made, but that's basically how people get a ulcer that never heals, because you need healthy tissue, which needs oxygen and good blood supply. So hopefully you guys can see how all of this ties together. Hey, Dr. Philandy, thanks for joining me. Um, so all and how all of this kind of ties together. Okay, so for those of y'all who are just joining, we are talking about the enemy amongst us, which is high blood pressure. I would make the argument there we have a few more enemies amongst us, which one I may talk about next week. Diabetes. That is probably it may be a little higher even on the list than blood pressure, but we'll get into that next week. Let's talk about diabetes next week. So high blood pressure. It is synonymous basically with our pipes. It's the piping system. It affects the piping system, which is our arteries in the body. Can affect one organ, multiple organs, or all of them at one time, right? So it is important to maintain our blood pressure. Hey, Sora Latrice, thanks for joining me. So it's important to maintain a healthy blood pressure and to know what your blood pressure is, whether you do that at your doctor's office, whether you that now technology is so advanced that they literally sell cuffs that you can just press a button and it'll give you your blood pressure. So I would, definitely recommend keeping an eye on your blood pressure so that you kind of know where you are, what's normal for you, especially for those folks who have not been to a doctor. Um, in the recent past, especially with everything going on with COVID. That's not hard to look up, and 6 months has gone by or whatever. So that's basically what we are talking about today: is how to address blood pressure. We have multiple medications that are aimed at, hey, Sarah Felicia, that are aimed at correcting your blood pressure. And they work in different ways. We won't get into the logistics of all of those things, but just so that you're aware, there are multiple ways to treat high blood pressure. Our first goal is always to try to treat it without medications, unless, here's the caveat, unless when you come to us, you are already so far progressed that we have to go ahead and start medications. And there are stages to your blood pressure. So let's say you go to the doctor and your blood pressure is 150 over 100. Okay, your doctor may give you a chance to implement some changes with your diet. Remember, I told you that African Americans are very salt sensitive. So they'll put you on a diet called the DASH diet, DASH. That's basically low salt diet, healthy diet, right? Trying to bring down the blood pressure, reduce the amount of salt and preservatives that's in your diet to see if that will actually work. for you. And for some people, it will. Weight loss is another one. Remember, we talked about that. The more pressure, the more weight that you have, the harder your heart has to work. The more pressure it's pumping against, the more volume it has to circulate. So you have a fixed amount of volume, right? That's in the body. There's no more, no less. And so if you're trying to get it around faster because you're pumping against, there's a lot more mass that has to dash. Yes. D8, not Mrs. Dash, but you do use Mrs. Dash when you can't use regular salts. But yes, the Dash diet. So when you're pumping against a higher pressure and have a bigger mass, so you're 50 pounds overweight, 100 pounds overweight, that can have effects on your blood pressure. Stress can have an effect on your blood pressure. So there's several variables that can be going on at one time affecting the blood pressure. So that is essentially how things work. So hopefully the analogy of the pipes kind of makes sense and kind of um, now you understand. So we've already talked about several ways that blood pressure can affect the body and why it's considered to be the silent killer, because most of us don't feel our kidneys or feel what's happening in your arteries, right? You have no idea what's happening until something catastrophic happens. And that's usually how high blood pressure works and why it's a silent killer. Okay, so I told you we could probably debate about diabetes also being on that list, and I'm probably gonna say that it is as well. And we'll talk about diabetes. That is a very heavy topic and a lot to cover, and something that a lot of African Americans, Hispanics, Pacific Islanders also have suffer with. So remember, we just talked about all the things that high blood pressure can do. Diabetes can do, it affects every single organ in the body, very much like high blood pressure. So imagine having them both. Okay. And so that's the vast majority of folks who have your heart attacks, your strokes. Those are major life altering events that can actually cause you to lose your life. So that's why I'm addressing them, because those are big ticket items that if we can get them under control and get them identified as problem areas early, then we can probably change outcomes, right? So that is what I have for you today. I hope this was helpful for someone. Please like and share this video. Somebody that you know, somebody who may not know who I am, or we're not friends on Facebook, likely has high blood pressure. They may have diabetes. So I'm going to try to bring you this type of content so that we can educate within the community and make sure that the information is out there. So please like, share this video so that somebody who might need to hear it can hear it. Alrighty. Thank you guys for joining me. Have a wonderful rest of your Self-Care Saturday. I hope you did something fantastic for yourself, whether that was exercise, sleep in a little later, read a book, went for a bike ride, whatever that was. I hope you're doing something always, not just on Saturdays, but always to take care of yourself. Again, thank you for joining me, and I'll see you guys next week. God bless.